Hi, Dr. Reeves here, neurologist and epilepsy subspecialist. Let's talk about seizure first aid. First off, there are a lot of different kinds of seizures, some of which require no first aid at all. If you're not sure about the different kinds of seizures, I have a video on that already. Take your time, go look at it, let me know when you're back. Okay, welcome back. If somebody has a generalized tonic-clonic seizure, grand mal, convulsion, whatever you want to call that, it's a pretty violent event. The first time you see one, you think, oh my gosh, I can't believe anybody survives one of these, but most of the time people do. The typical convulsion lasts about 2 to 2.5 minutes. 3 minutes is not particularly striking. 4 minutes is getting really pretty long. Occasionally I have a patient who routinely will have seizures from 3 to 4 minutes, but the majority of people would be 3 minutes and under. 5 minutes is a medical emergency. When the body is convulsing, and there are all these rhythmic movements of the muscles that are kind of obvious on the outside, the muscles on the inside, the muscles between the ribs, the muscles of the diaphragm, they're convulsing too. So people really aren't breathing. So it's fairly typical that during the seizure, oxygen levels drop. There's a huge amount of oxygen being consumed through all the vigorous movement, and there's not really much in the way of new oxygen coming in. So a blue tinge around the mouth and such is to be expected. You can't give CPR, you can't give artificial respirations during a seizure because the diaphragm is seizing. Once the seizure's over, they start breathing, and you should look for the blue tinge or the pallor, the whiteness, the duskiness to improve fairly quickly over the course of 20 or 30 seconds. During the seizure, there isn't anything you can do to stop it. Nothing into the mouth. Don't put your finger in there. Don't put a spoon in there. Don't put a chair in there. Don't put the sink in there. All you're going to do is break teeth and lacerate the gums. You can't prevent them from swallowing their tongue because you can't really swallow your tongue. It's attached. All you can do is clear things away that the person might come in contact with, bumping against chairs or walls or what have you. Keep them from harm from something like a fire or a swimming pool or something where they're going to get really hurt by having the seizure. Put them into that. And then when the seizure's done, you want to roll them onto their side if you can safely do so. That's because often there's a lot of drool, and we want that to run out. We don't want them to necessarily suck it into their lungs. Maybe loosen their collar. Try to make them comfortable. They need to go to the hospital, generally speaking, under one of 3 general conditions. The first is a seizure lasting 5 minutes or more. The second is a seizure with significant injury. I'm not talking a carpet burn from rubbing against the carpet, but I'm not talking having bitten the tongue or something like that, but a significant injury. This would include cuts that need to be sewn up because they fell on the edge of the coffee table, dislocated shoulders, broken bones, that kind of thing. And lastly, if they have more than one seizure without return to some normal baseline between. So somebody who has say a 90-second convulsion, they're sleeping it off, and an hour later they have a 60-second convulsion. This brain is heating up and really in danger of going into ongoing and unbroken seizures. So that's Seizure First Aid 101. Thank you for watching.